Welcome back, everyone. Well, it can be a difficult diagnosis for a child to deal with. Today, we're learning more about lazy eye, its causes, symptoms, and even treatment options. I'm joined now by Dr. Farrah Sunderji with Eyedeology at Centennial Clinic. Thanks so much for joining us this morning.
Oh, you're welcome.
It's good to have you back. I know you've come on the show before with some really helpful advice and some tips. And today, we're talking about lazy eye. So what exactly is it?
So lazy eye or amblyopia is the leading cause of vision reduction in children. It affects roughly 2 to 3% of the population. It develops when the nerve pathway between the eye and the brain is not stimulated correctly. So the eye then tends to favor the eye that sees clearer, and it suppresses the other eye.
Okay.
When the brain suppresses that eye, clear vision does not have a chance to develop, and the eyes are not being used together effectively, and there's a reduction in depth perception or 3D vision.
Oh, that doesn't sound like fun. So then what causes it?
So there are 3 main causes of lazy eye. The most common is a strabismus, which is also known as an eye turn or a wandering eye, in which there's a misalignment of the muscles. So one of the eyes is pointed in, out, up, and or down. The most severe cause of amblyopia is deprivation, in which there's an obstruction that deprives vision in that eye. An example of this would be a cataract, which is a clouding of the lens in the eye. An opacity, droopy eyelid can cause that. The third cause is refractive. So that's when there's a significant difference between the 2 eyes in the amount of farsightedness, nearsightedness, and or astigmatism, causing the eyes not to work together effectively.
Would you say this is common? Is this rare? And we're talking about children, so is this common in children?
So roughly 2 to 3% of the population. We advise parents to monitor their children and make sure that their eyes are working well together, that they're coordinated, so there's no misalignment of the eye, they're tracking well, and there's no reduction of depth perception.
Okay, and then as far as treatment options, if you do see these signs in your child, what are the treatment options?
So if your optometrist diagnoses your child to have a lazy eye, there are several treatment options, and they can be used in combination. So we can prescribe eyeglasses and or contact lenses, do eye patching where we stimulate the vision in the eye that doesn't see well. Eye drops can be used for the similar purpose. We can also do vision therapy or eye exercises to train the focusing system, eye tracking, and eye coordination. In certain cases, eye surgery is needed to correct a misaligned eye, remove a cataract or a droopy eyelid.
Okay, and early detection is key with this?
So lazy eye, early detection is the key, and that's done through early eye examinations. So we advise parents to bring in their children as early as 6 months of age for their first eye exam, and thereafter annually. Alberta Healthcare covers annual eye examinations for children under the ages of 18 years with their optometrist.
So a good idea to bring them in for sure. Seems young, 6 months, but like you said, it's covered and you can detect, you know, these kinds of things early and get it treated soon. Thank you so much, Farrah, for coming in. Really appreciate it. Great advice.
Thank you.
You can get more information at www.eyedeology.ca. We also have a link on our website, globalnews.ca/Calgary. And also don't forget to pick up the latest edition of Calgary's Child magazine. It's on stands at various places in Calgary. You can also like them on Facebook, and you can follow them on Twitter.
No one is getting younger. As we age, so do our eyes. There you go. For Eye Health Month, health specialist Leah Sarich joining us now, chatting about the first signs of aging, our aging eyes, and what we can do to protect our peepers.
You only have 2 of them, right?
That's
so you got to look after these guys. So have you noticed that you're doing this a bit more? Yeah?
I don't want to admit it.
Yeah, I don't want to admit it either.
You know what I do? I do the finger thing where you zoom in.
Oh, yeah, just make it a little bigger.
Yeah,
exactly, right? So that, in fact, is one of the first signs of aging. I spoke with optometrist Farrah Sunderji about this, and she says, yes, that is, in fact, that our eyes are aging.
The first sign of aging usually occurs around your early 40s to mid-40s when you start noticing things up close get blurry, so you're moving things further out to see them. This is called presbyopia, and it's basically a condition in which the eye loses its ability to focus up close and see objects or small print, especially medicine bottles. This is a normal change that occurs with time, so it's really important to come in and see your optometrist, and we can determine the best form of treatment, and that usually ends up being glasses.
Yeah,
Boo.
we know the glasses. I know, boo. Other signs of aging eyes include floaters. So this is where you get little black spots that float through your vision, or cobweb kind of things.
Okay,
yeah,
so check for those two.
Exactly, that's a very common sign of aging. And it's not a big deal. It's very, very common unless those floaters are accompanied by flashing lights.
Oh.
Then we've got a medical emergency and you need to see your optometrist right away. It could be a torn or detached retina. So keep that in mind. Another sign, tearing or watery eyes. So just if your eyes are watering a lot, you're getting that tear in the corner of your eye a lot. Very common in women during menopause. So definitely something to keep an eye on. Could be dry eyes, infection, blocked tear duct, another reason again to see the optometrist. Another one is the drooping eyelids. So, you know, we see this and women are getting that fixed all the time. So it's not just a cosmetic issue. In fact, it can affect your vision.
What does it do? Does it like actually literally block it?
It does.
Oh, okay, sure.
It does. So it's worth getting an optometrist to assess that. You could be a candidate for surgery. So, something to keep in mind. Now, these are just basic eye problems as we age, but as we age, we're also susceptible to more serious eye diseases, like macular degeneration.
With age, we can see age-related macular degeneration, which is the leading cause of blindness in Canadians over the age of 50. Risk factors for this include being female, Caucasian, light skin, light eyes, having a history of smoking, poor diet. Family history is huge when it comes to macular degeneration.
So that's definitely one to keep your eye on for sure. Absolutely. Other eye diseases related to aging include...
There are a lot of them.
There are a lot of them. Cataracts, again, very common. It causes vision loss, but it can easily be treated with surgery. So that's an easy one. Glaucoma, an increase in the pressure of the eye. Again, this is something that an optometrist can check very easily. But if it's not detected early, which it often is not, it can be very problematic. It's a huge cause of vision loss. The key here is that most of these diseases do not have any symptoms until they're very advanced.
Oh, really? Okay.
Yeah.
Okay, so, I mean, prevention. How can I stop this stuff from happening? Because, I mean, we can't reverse how old we are.
Correct.
So, yeah.
That's right. So there's a few things you can do. The first thing you want to do is visit your optometrist annually. Every year. Just like you're getting your annual physical exam, you want to get your annual eye exam. The other one I really like is the 20-20-20 rule. So this is a good one, particularly for all of us who are using our devices all the time. She says every 20 minutes, take your eyes off your device and look 20 feet away for 20 seconds.
Oh, really?
Yes.
So you're on your phone every 20 minutes, so 3 times an hour.
That's right.
Just take a second and focus in
20
the distance.
seconds. Take 20 seconds.
Yeah, okay,
yes, 20 seconds to do that. And that just gives your eyes a break. So it's reducing that eye strain that we see a lot of. And then again, in Alberta, remember that if you have an emergency with your eyes, you do not need to go to the emergency room. You can, in fact, see an optometrist, and it will be covered by Alberta Health.
Ah, there you go. Good advice. It'll be all this info on your blog.
Hi, I'm a practicing eye care professional, and I'd like to tell you a little bit about the latest scientific information on dry eye, a condition that affects millions of people. Everyone's eyes produce tears. In healthy eyes, these tears help keep the surface of your eyes well lubricated for blinking, maintain a smooth and clear surface, bring nutrients to the eye tissues, and also protect against bacteria, infection, and airborne dirt. In the case of people suffering from dry eye, their tears are not produced in adequate amounts, or their tears do not have the right ingredients and therefore do not work properly. Patients with dry eye may experience dryness, burning, itching, scratchiness, fluctuating or blurred vision, and heightened sensitivity to light. Some patients with dry eye experience excessive tearing because the tear-producing glands are trying to compensate for their eye's abnormal production of tears. If left untreated, chronic dry eye can damage the surface of the eye, interfere with the vision, and limit day-to-day activities such as driving, computer use, and reading. New research has linked dry eye to the activation of the body's immune system on the surface of the eye. This immune response, or inflammation, takes place on the part of the eye responsible for producing tears. Inflammation around the eye can be triggered by a number of other factors, such as environmental conditions, use of certain medications, some surgical procedures, hormonal changes during menopause, autoimmune disorders, contact lens use, and more. When the tissues of the eye become inflamed, this affects tear production. Either the amount of tears is decreased or the quality of tears is poor. As the eye gets drier, it becomes more inflamed and starts into a downward cycle. Increasing dryness causes increased inflammation, which affects the quality and quantity of tears, which in turn leads to more dryness, and so on. In light of the new research on the role of inflammation in dry eye, doctors are now focusing more on getting at the root of the problem by targeting inflammation rather than only managing symptoms with artificial tears. Ask your doctor about treatment options that work differently than artificial tears to help treat the inflammation and break the cycle. By getting the inflammation under control, the irritation will decrease, leading to healthier tear production and long-term symptom relief.
Vision care is an important part of your baby's development. There are some steps parents can make now to prevent problems later. For a lesson on Infant Vision Care 101, we have Dr. Farrah Sunderji joining us with Eyedeology this morning in Calgary's Child. First of all, good morning to you.
Good morning.
We talk about getting our eyes checked. For adults, we go and we read the different lines and that sort of thing. I imagine, though, for babies, it's not that easy.
No, it's a little bit different than what you and I would experience at an optometry exam. Infants cannot tell us how well they see, or they can't read the chart. So optometrists use nonverbal or objective testing to test the child and make sure that they're seeing well, that we determine if there's a need for glasses. We also check vision skills such as focusing, eye coordination, eye tracking, as well as the health of the eyes.
So how soon should we get an eye check if we have a little one at home?
So I recommend children should be coming in as early as 6 months of age. That's when we begin testing on infants, and thereafter annually. Alberta Healthcare covers yearly examinations for children between the ages of 0 and 18 years.
Okay, so there's no cost. So there's no excuse really not to do it.
Exactly.
You have some steps, 3 steps parents should take when it comes to their child's vision. So part of it is going and getting them checked, right?
Of course.
Yeah.
So parents play an important role in the vision development of their children. I advise parents to monitor early on for signs and symptoms, and then to bring them in to see their family eye doctor, their optometrist. I also advise parents to ensure that their children are engaging in age-appropriate activities to help stimulate eye and vision development. Vision skills such as focusing, eye coordination, eye tracking, as well as how the brain processes what we see are all learned skills. In fact, 80% of learning is done through the eyes, so you can see how critical vision is in the development of a child.
As a parent, though, how do you know if maybe your child's having problems? Is it that they're struggling, or they're aggravated, or how is it obvious if you have a little one who you may not be sure? Maybe if they're hungry, maybe they have gas or that sort of thing.
So there are vision problems that we do want parents to monitor for. And examples of those are eye turns, where the eye is turned in, out, up, or down, as well as if you're noticing your child is squinting when looking at objects at various distances, or if they're closing one eye, especially in the sunlight. This can suggest that the vision in one eye is poor, or that they have a lazy eye. If you notice any kind of redness, tearing, excessive discharge, this could be an allergy, an eye infection, or a blocked tear duct. And more seriously, if you notice a whitening of the pupil, it is more of a concern because it can suggest a cataract or a cancer of the eye.
Oh, wow. All good tips. So again, you want to get your little one's eyes checked. If you would like some more information, you can go to Dr. Farrah's website. That's at eyedeology.ca. And also, don't forget to pick up the latest edition of Calgary's Child magazine. It is on stands in various places around the city. You can also like them on Facebook or follow them on Twitter. Thank you for coming in this morning, clearing that all up for us.
Thank you for having me.
If your kids are in sports, you know all about the protective gear. There's helmets, shin, knee, elbow pads. The list goes on and on, but of course, what about protecting those eyes? Well, here to chat more about that is Dr. Farrah Sunderji, and joining us from the Eyedeology at Centennial Clinic. So, I mean, again, we know that there's these sort of things, these protection that is required for sports, but you know, a lot of people, they still don't get on that eyewear issue.
That's so true.
Is there common injuries that you see people coming in with?
Certainly. So injuries can include anything from a blow to the eye from a ball, a cut to the eye or eyelid, a particle entering the eye, or even a chemical entering the eye. So if any of these occur, we encourage patients, parents, children to come in and see your optometrist immediately. Alberta Health and Wellness covers medically necessary visits for all age groups, so it's really important to come in and see your optometrist.
Okay, so you've got some examples of different eye protection. Now, what are these various ones for? Of course, we know these ones, the goggles.
Right, so goggles are a great device.
Yeah.
They are especially important for sports that involve a ball that travels at high speed or a racket. They can also be used for skiing purposes as well as swimming. For goggles, the lenses can be made with a prescription, so the child does not have to wear glasses underneath the goggle. And we encourage parents to look at a material called polycarbonate for the lenses, as it's impact resistant, thin, and lightweight. If the goggles are used for skiing, it's important to ensure that they have 100% UVA and UVB protection. And if they're used for swimming, it's important that they form a tight shield against the skin of the eye to prevent chemicals from entering the eye, such as chlorine or even bacteria.
Absolutely. Now, these ones are interesting. This one specifically would be used for racket sports, is that right?
Yeah, you can use it for tennis as well. Basically anything, like I said, with a ball that travels at high speed or a racket.
Yeah, I like how they have sort of the foam here as well, because we all know we've been hit once or twice with a ball in the face. It's nice to have just a little bit of protection there. Maybe
Agreed.
save you from a black eye or something. Now, I love these ones as well. Purple, of course, I know Gemma would love these ones. Kids also need to be protected, the young ones, the babies.
Definitely. So sunglasses are excellent, and really everyone should be wearing it all year round. We want to ensure that the lenses have 100% UVA, UVB protection, and the added benefit of polarization significantly cuts down the glare off of reflected surfaces such as snow, water, as well as sand.
Okay, any advice for people if you do get injured? What's the first step?
So come in and see your optometrist. I was also going to mention that if your child currently wears protective eyewear, or you're unsure what type of eyewear is good for your child, come in and see your optometrist during your annual eye examination for your child, and we can review what they're currently wearing or even make suggestions of what they should be wearing. And just as a reminder, Alberta Health and Wellness covers annual eye examinations for children under the ages of 18. Annually with your optometrist.
Perfect. See, there you go. And you can come in and see Dr. Sunderji. Thank you so much for coming in.
No problem.
For showing us our nice collection of eyewear. Hopefully you can get out there and enjoy the sun, some sports today. And again, you can check out the latest edition of Calgary's Child Magazine. You can also like them on Facebook and follow them on Twitter.
How do you like my shades? If you've been spending any time outside during these past few sunny summer days, you know you need a good pair of sunglasses. But not all lens and sunglasses are created equal. Optometrist Dr. Farrah Sunderji joins us this morning with some tips on how to find a good pair of sunglasses. I really like these ones, and these have lenses obviously in them. Talk about the importance of picking a lens that has protection, because obviously your eyes do need that.
Of course. So it's really important when you're choosing lenses to ensure that they have 100% UVA and UVB protection. Simply wearing dark lenses without any information on them can actually be detrimental, as it can widen the pupil and allow more sun to enter the eye, causing damage. What's also important is to look for polarization. It eliminates glare, gives you a crisper, cleaner image, and also reduces eye fatigue and strain. It's also important to look at both lenses and ensure that they're uniform in color and that there are no distortions on the lens itself.
Okay.
Scratch resistance is great because it increases the durability of the lenses, so they last a lot longer. Now, one of my favorites is the Maui Gym collection. So there are different lens colors whenever you choose sunglasses.
Right.
So the gray provides the lowest light transmission, so it's great for people who are light sensitive. And it also keeps the true image of the true color of the image.
Okay, so you're not getting sort of a rosy sheen or a green type
Exactly.
sheen. Okay.
And then we have the bronze, which provides a warmer tone to the eye. It's great for everyday wear.
Okay.
There is the rose, which provides the highest contrast, so that's great for sports.
Right.
And then we have the green, which provides the highest light transmission, so it's great for overcast days as well as winter. And currently, this Maui HT lens is the #1 lens on Golf Digest.
Oh, interesting for sure. When you're picking out sunglasses, is there a sort of a frame shape that you should be looking for that would provide you with better protection?
So you do want to make sure that the sunglasses are not too small. You want to make sure that it's covering fully around the skin. So currently what's trendy are big frames.
Right.
So we have the reemergence of the cat eye as well as round frames.
So something like this, or perhaps something like this.
Exactly.
Okay.
Those are great.
And how do you know if it's providing enough coverage around your eyes?
So you shouldn't really be getting any sun coming in, otherwise you're going to be squinting.
Okay. For people who are perhaps not comfortable wearing sunglasses and wear contact lenses, do those provide any level of UV protection?
There are certain brands that do provide UV protection, but again, you still have to wear the sunglasses over top because you want to protect the skin around the eye.
You've brought in some examples of lenses here that have different colors and different finishes to them. Is there any of those that have a particular benefit when it comes to sun protection?
So like I said, you want to make sure that it's 100% UVA and UVB, and you want to ensure that your lenses say that. So these mirrored lenses are very trendy this season, and the great thing about the mirrored lens is that it reflects light that comes onto the front surface.
Okay, some really good tips. Thanks so much for coming in this morning. If you'd like more information about the latest UV protection, you can check out the UV Canada smartphone app and for up-to-date information on radiation on your exact location.
We hate to break it to you, but it is August 1st. As much as we don't want to, it is time to start thinking about back to school. Our health specialist, Leah Sarich, is here now with why getting your child's eyes checked before September should be a part of your back to school routine. This is a good idea.
It really should, yeah. And the main reason here is that 80% of learning happens through the eyes. So the bottom line is that if your child is not seeing properly at school, they're not learning properly.
That makes a lot of sense.
It does.
That 1 in 4 children have an undiagnosed vision problem that interferes with learning. A vision screener that's performed by a school nurse or your physician or a pediatrician is not meant to replace a comprehensive eye examination. Statistics show that 40% of students that pass a vision screening fail their comprehensive eye examination, because vision is not just about how well you see, it's about how well the eyes are functioning as well as how healthy they are.
There you go. So let's revisit that. 1 in 4 children have an undiagnosed eye problem. So this is why it's so important to get them in there and get them checked out. What also can happen if your child has an undiagnosed eye problem is they may not be seeing and learning properly, and that could lead to a misdiagnosis of something like a learning disorder. Or even an attention disorder like ADHD. This happens quite often. So you want to rule out that their vision's okay and something else is going on.
Right.
The other thing, of course, that Dr. Sunderji mentioned, they're going to look at things like whether or not your child might have allergies that are affecting their eyes, whether they've got dry eye, conjunctivitis, whether they even have an underlying medical condition that requires further investigation in that eye.
Okay, so we're talking about kids here. So does a child's eye exam look a little bit different, particularly in kids who may not be reading yet?
Exactly, so it does. So, you know, we go to the eye doctor and we look at the letters on the sheet. So that is not what the kids are going to do, especially if they can't read. They'll use a little sheet just like that one there. So you can say, oh, can you see the birdie? Can you see the kitty cat? That kind of thing. She's got little toys like this little guy, which will help do the tracking of the eye. This is for color blindness, right? You have to look for color blindness. There's Winnie the Pooh there. She's looking for depth perception there. So these are all things that she's checking for. That's depth perception again, whether things are going to pop out or not for your child. They get to wear fun little glasses and things like that. So yeah, it looks very, very different. So she's looking for those vision skills, eye coordination, eye tracking, things like that. And as the years go on, parents should really watch for other various symptoms and then report them back to the optometrist when they go every year.
I encourage parents and children to monitor for various symptoms, and those include blurry vision, any type of squinting, headaches, eye strain, fatigue, monitoring for double vision, a strabismus, which is an eye turn, as well as if you're noticing your child is tipping their head or tilting it, or a head turn at various distances, monitoring for excessive blinking, tearing, or watering. These are really important to bring up with your optometrist because we can determine a cause as well as the best treatment option.
Right? So we probably don't even think about those things. You know, if you see your kid going like this, you think, oh, there's something going on there. Let your optometrist know. That's why we go once a year. So Dr. Sunderji is recommending that parents watch also for how the child is learning. So not only for those head tilts and things like that, but if they're skipping words or letters, or if they're reversing letters when they're writing, things like that, all things to bring up with the optometrist for sure.
Okay, I shuddered. I hate to ask this question because I know I'm going to get in trouble here. How old should your child be at their first exam?
Okay, well, ideally, the optometrist would love to see your child at 6 months of age, if you can believe it. 6 months, true story. And then annually after that. But realistically, they would really, really like it, at least if you can get them in there before the school year starts. So that would be great.
Okay.
And two things I have to mention very quickly is that it's free for all children in Alberta to go do this. So there's no excuse. You really just have to go out there and get this done. It is absolutely free. And then if your child is going to kindergarten, they can actually get a free pair of eyeglasses if they require them through the iLearn program. So really, this is open to all children in Alberta. It's such a good idea to get their eyes checked before they go back to school.
Okay.